Some, kind of obvious things probably need to be said before we go in there. Jenny Smith is going to assist us today in, kind of reading a horse's behavior, and so you'll understand maybe what the horse is thinking and feeling at the time that you go in there to keep you safe. Some of the real obvious stuff is, just like with any other animals that we've dealt with, make sure you've got on closed-toed shoes that have some protection for your feet. Horses tend to be, anywhere from, unless they're ponies, 950 pounds on up, and getting your feet stepped on is a reality and a risk at times. But probably the most important thing that occurs with horses and cattle that doesn't necessarily occur with anything else are people's dogs that are in the vicinity. And probably nothing will get you hurt as quickly as a dog that doesn't know what he's doing. And lots of people have got dogs that aren't really, really well trained. You probably need to understand that both the horses and cattle at times are real apprehensive about the dog, and will start paying more attention to the dog than they will to you. And that increases your likelihood of getting hurt. So a couple of things today. I think we're going to go ahead and take a look at two horses and see if we get any different reaction, how Jenny interfaces with them, probably a vaccination on one and maybe deworming on the same one or the other one. But reading horses are really demonstrative a lot of times with their ears and what they're thinking and what they intend to do. And if you can read those things, again, it lessens your chance of getting hurt.
Hi, today we're going to work with Dose. He's a 14-year-old quarter horse gelding, and I've had him about 4 years, and he's probably one of the best well-mannered horses that I've had. So today he's probably going to do everything that I ask him to do. And the most important thing, other than having the horse and some knowledge, is the facility that you work in, to make sure that you're not working in a space that's too small that the horse can't get away from you, and it's not so large that you have a hard time working the horse. And we walk in with the horse, and we're going to pretend kind of that we've never met him before, but we're going to look at his body language and his ears. And right now he's pretty relaxed. He's focusing on the other horses. He's not real concerned with us, but it's not really a bad manner thing. Now when I go to approach this horse, what I do want is his focus to be on me. If the horse tends to keep his rear towards me, which is a dangerous situation and disrespectful all in the same, I'm going to move the horse around until he turns to me, or at least gives me his shoulder, and stops and relaxes and lets me approach him. So today I'm going to walk up to him, and like I said, most likely he's just going to stand here. He's going to let me do whatever it is that I need to do. Walk up, and normally I would just put the halter rope around his neck so that I have him, pull him into a position to where I get the halter on him. And of course, this is all ideal in a perfect world. And there you would have your horse, nice and calm. But let's just pretend for a moment that he didn't face me. And let's say he was nervous, or he was kind of a runaway. If he went running around the pen, I would need to let him relax, move him around until, again, he would look at me, give me a shoulder, at least stop and relax. Never approach a horse from the rear, and you want to stay at the side, not directly in front of. And then he should stop and face me. But if they tend to be nervous, they tend to be running around, what I will do is I will walk up, I will touch the horse first. I won't attempt to halter him. I'll walk away. Preferably they'll either follow me or stand there and face me. And still assuming that we're working with a horse that we don't know very well. And now we have him in the halter, and he seems to be handling okay. If you're going to do any type of vaccination or deworming or handling of any sort, the last thing you want to do is to tie him up in any way. You want the horse to be able to move away from you at any point to keep you safe. You can always go back and work on that comfort zone later, but at least let that horse always move away from you. Never tie him up when you do that. Put the halter rope over their neck and be able to handle all their feet in this manner. You face the rear of the horse, you run your hand down their leg, pick up his foot, do whatever it is you need to do, keep your feet safe because they don't know where they're at, and then set their leg down gently. When you go to do the back foot, when you're starting out a young horse or you're starting out a difficult horse or you don't know them, you run your hand down the back part of the leg, you bring the leg forward and you pull it towards you. This is only because if the horse decides to kick at that point, you're in front of all the action. He can pull away from you, but he can't actually get a handle on you with his leg. You pull it forward. Seems like he's okay. You can go ahead and walk it back, set it on your knee, and clean it out. If a horse tries to jerk their leg away from you, which is common, and it's bad behavior, and he's not going to do it, like I said, he's going to be pretty well behaved. You're going to hold it up. If they try to get away from you, you will not win that battle. You just have to keep going back to it until they rest their leg in your hand, and you can gently set it back on the ground. They should not slam their foot down, and they shouldn't fight you in any way. When we're doing vaccinations, and I do this regardless of the horse's disposition, I never have them tied up. Again, that's very important. Always have them loose. And I prefer to do it alone. I don't like having two handlers on a horse when I'm trying to get something done if I have any problems or issues. And there's 3 spots you can give we're giving West Nile today. There's 3 spots you can give an intramuscular shot at, and that's here in the neck, in the chest, and in the rear. But the easiest spot is here in the neck, and it's probably the safest spot, other than the chest can be okay. If you're just giving 1 shot, this is where I tend to go to. And what I do is I separate the syringe and the needle, because if the horse is going to give me problems, at least I've only got a little syringe in his neck, and if it falls out, I can replace it, and I don't have $30 worth of medicine stuck in there that may come undone or flopping around. What I do is I take it out when I'm ready to give the shot, and when I teach people to give shots, I start, this is the bottom of my triangle, we come up at the top of the triangle, and that's where I give the shot at. And I just poke it in. Of course, he's going to be okay. And then I do that, make sure that your needle is back in right away, and it's as simple as that, preferably. One thing I did want to cover that I forgot in the last part is when you're leading a horse and you have the halter rope, do not wrap the rope at any point around you. Always have it loose in your hand. The horse is to stay at your shoulder or behind, never in front of you, and not too long of a rope. Keep them right with you. And this is Peanut. She's a 6-year-old horse. Not as consistent in good behavior as Dose is, but still pretty good. She's real gentle, and again, a quarter horse. And today I'm going to deworm her, and we're going to see if we have any issues. Most of the time she's been doing just fine. I can get a bridle path cut on her and so on, so she does pretty good, can handle her feet. So what I do when I deworm them, and if I think again that I'm going to have any issues, or it's a horse I haven't handled, or it's a young horse, I'll just prepare for that, have everything ready, maybe. And what I do is, and never have your hand inside the halter rope as well. Always have everything loose. Is I'll go up and I'll actually stick my thumb in the corner of her mouth, kind of tell me if she'll tolerate that. And then I'll go ahead and stick the dewormer in there. And as you can see, she's kind of walking backwards, but not bad. She's not throwing a fit, not throwing her head. But there again, at least I'm not wasting the dewormer. I just have my thumb in there, and I'm just making sure that she'll tolerate that. And go ahead and stick it in her mouth. And that's that.